I'm Grace Corkhill and I live in country New South Wales. In 2013 I had a cerebral artery aneurysm rupture and that caused a stroke and paralysis down my left side. I was also diagnosed with epilepsy, and then after that I was diagnosed with FND as a result of all that original trauma. So FND is functional neurological disorder. It's where the messages between the brain and the nervous system are confused and the specialists say are a bit muddy.
The thing that makes FND complex is the variability in the way that it presents. People can present with a plethora of symptoms, really, that in the context of FND reflects, as we understand it, a problem in the way the brain is communicating with the body.
It can come from a psychological issue or it can come from a neurological issue.
There's a commonly held misconception about FND that it is a purely mental health issue, and it's not. It is as much a mental health issue as it is a physical health issue.
So my symptoms were physical leg shakes. I struggled a lot with the fact that I could just be sitting here and I couldn't pinpoint a trigger, but my legs were still shaking. That mentally affected me a fair bit, so then the mental health thing sort of probably came into play a bit, and the anxiety around them happening in public, and I didn't go out in public a lot for a little while because I was so worried about something happened. I stopped my work. I reverted back to old habits, which were bad habits, of just staying inside on the lounge and only seeing my family, my mum and dad, because I was so worried about these shakes happening out in public or at my workplace.
It's a safe estimate to say roughly about 1 in 6 people that see a neurologist in their clinic will be diagnosed with an FND, and most community surveys would support that. So it's a very common condition.
I met Addis at the hospital and then he said, we're going to do this 6-week trial period, therapy type thing. And lucky for me, living in country New South Wales, they were extremely flexible, being able to do it by Zoom.
So the clinic itself provides a clinical service. And then what we've built on top of that is a very robust research data collection system that allows us to measure the impact of what we're doing.
So the 6-week program involved a neuropsychiatrist. I sat with 3 different therapists, one being a psychologist, a physio and an OT.
And FND is treatable, even though a cure is too simplistic a way to look at it. FND is inherently treatable, and even simple things like educating people about their FND and providing basic interdisciplinary intervention as we do. We only run a 6-week program, can go a long way towards improving somebody's quality of life.
I noticed improvements each week just from those little things that I was doing. It was very proven that everything that they put into place had worked.
To recognise there are a number of people out there with FND that are receiving very little and struggle with their condition, and they don't need to.
On the list of my medical conditions, FND is going to be there. That's just a reality, but I just have all these strategies and the team is incredible, and I have that all in check to be able to go, well, I can manage that. It's almost like I feel back in control of my life because of the treatment I've received, because of how far I've come since I had that first symptom. If it does come back, obviously, it's just in the back of my head that I can go, well, I have those tools, and how amazing is it that I've had these tools from this team to be able to almost fix this medical condition. Like, that's amazing.
Mindgardens has been completely delighted to be able to support the FND clinic that has been set up here at Prince of Wales. Mindgardens really tries to bring together the best of clinical work and researchers to improve the lives of people with real health conditions. In this case, with FND, it's something that neurologists see and psychiatrists see, but often there hasn't been a comprehensive treatment program, and sometimes there's not even a comprehensive assessment program. So Mindgardens has been able to bring together this opportunity to have a clinical and research-backed, evidence-based program to support people with FND.
So RHIP's role in all of this is to facilitate and find the points of intersection between all our partners. I mean, Mindgardens is at the forefront of health, education and research and driving better patient outcomes.
Each of the separate organisations wouldn't be able to do this on their own, but Mindgardens' beauty is to enable the gluing together of the different groups in order to facilitate this translational health, clinical and importantly impactful service.
Experts from across the precinct have pooled their knowledge and resources to make a tangible difference to the community. Whilst the collaboration and groundwork beyond Grace's inspiring story has taken place here in Randwick, its impact has no jurisdiction. Our precinct is one without borders, one that is changing lives from those within and beyond its bricks and mortar, one that is putting patients at the centre and will continue to do so into the future.